Nigeria is the bustling center of Africa, and Lagos is the center for healthcare in Nigeria, particularly for women. But our state faces barriers that slow progress and force women to seek healthcare in the shadows. Restrictive abortion laws and intense stigma compromise access to safe abortions and contribute to needless deaths. And low contraceptive use leads to unplanned pregnancies that can increase the demand for safe abortion services. We can prevent these needless deaths if decision makers prioritize access to safe abortion. A woman or girl might choose to end a pregnancy for many reasons.
I had a serious health concern.
I couldn't bear to be pregnant as a victim of sexual assault. I gave birth very recently, and my husband and I couldn't take care of another child so soon.
I was so worried about our finances, and I knew it wasn't time.
I felt so ashamed for becoming pregnant outside of marriage.
Often, women have nowhere to turn. Data show that in 2012, more than 9 million pregnancies occurred in Nigeria. 25% of these pregnancies were unintended, and more than half of those unintended pregnancies ended in abortion. In 2017, 1.8 to 2.7 million pregnancies in Nigeria ended in abortion. Most of these abortions are unsafe, performed by someone without formal medical training or in a substandard environment, or both.
There are so many physical consequences of unsafe abortion. They will be brought here bleeding. Some will have sepsis to their reproductive organs, like cervix, from cervix to the uterus, and even generalized infection, septicemia. There could be damage to their reproductive organs, and in which they will not want to discuss with anybody. They will have that emotional disturbance within them.
Current available estimates of Nigeria's maternal mortality ratio range from 576 to 814 deaths for every 100,000 live births. Unsafe abortions contribute to Nigeria's rising maternal mortality ratio, which is among the highest in the world. Estimates show that unsafe abortions account for roughly 5,000 maternal deaths every year in Nigeria, or on average 14 maternal deaths each day. Yet, when an abortion is performed in a timely manner, under the supervision or care of a trained health provider, and in a facility that meets minimum medical standards, major complications are very rare. So why do women resort to having abortions under unsafe conditions? Restrictive abortion laws, prohibitive costs, poor access to safe health services, and intense social stigma are barriers that prevent women from accessing safe and legal abortion. One key barrier to safe abortion in Lagos and throughout Nigeria is a lack of awareness of safe abortion laws. So what is the current legal framework for abortion in Lagos State? First, the Lagos Criminal Code that governs abortion, updated in 2011, stipulates that abortion is legal to preserve the life and physical health of a woman. The code also requires that abortion is performed by a medical doctor. Second, medication abortion, such as Mifpac or Mariprist, is allowed up to 9 weeks of gestation, as stipulated by the National Agency for Food and Drug Administration and Control. Protection of a woman's physical health as a condition for legal abortion is a unique feature of the Lagos Criminal Code, but very few people are aware of the provision. In one survey of 49 Nigerian policymakers and executives responsible for maternal health legislation, none could correctly state the specific provisions for a legal abortion. Law enforcement officials may wrongly prosecute service providers who are operating within the law.
As we speak, even public health facilities are not in any state of preparedness to offer legal abortions. One, because most of the medical and nursing personnel are not even well informed about the law, that there is a narrow window of the law that gives a permission or that allows public health facilities to provide legal abortion. We must now, going forward, put our public health facilities, especially the secondary health facilities, in a state of preparedness to offer such a legal abortion service, and the populace must be made to know about it.
Importantly, the Lagos Ministry of Health is currently taking steps to disseminate the 2011 Criminal Code across the health system and to require that safe abortion services be provided within legal indications, including protecting the physical health of the woman. At the same time, Lagos State has yet to take two important steps to prevent unsafe abortions. For starters, Lagos has not yet adopted the 2015 Violence Against Persons Prohibition, or VAP Act. The VAP Act protects girls, women, and marginalized communities from abuse, and it is an important tool to reduce unsafe abortions because it ensures comprehensive medical services for victims of rape and incest. Without the VAP Act, victims of abuse may feel compelled to take abortion into their own hands and risk compromising their physical and reproductive health. In addition, abortion laws in many countries, including the United Kingdom's landmark case, Rex versus Bourne, recognize the mental distress of unwanted pregnancy as a contributor to physical health. But Lagos' legal framework stops short of recognizing the mental burden of unwanted pregnancy for women and girls. The experiences of countries around the world show that making abortion illegal only makes it less safe because safe abortions become costly or limited to private practices in urban areas. In these settings, poorer and rural women are forced to seek services from quacks and other less safe options. In 2007, despite deep religious opposition in a country with the second largest Catholic population in the world, Mexico City legalized abortion up to 12 weeks without restriction due to growing concern about the high number of unsafe abortions. A number of reproductive health policies were implemented in the city, including free abortion services at some public clinics. Maternal deaths from 2008 to 2012 were up to 16% lower than 2001 to 2007 because of these policy reforms. Unsafe abortions are also costly to women and healthcare systems. Post-abortion care in hospitals, which is often needed to treat complications of unsafe abortion, can be as much as 6 times more expensive than a safe abortion. A 2005 study found that the average patient in Nigeria pays 11,000 naira for post-abortion care. Another study found that in 2012, public hospitals in Lagos, Ogun, and the Federal Capital Territory spent 123 million naira to treat abortion complications. If safe abortions are available within the full extent of the law, we can decrease the significant financial burden on women and the state. In Lagos, access to safe abortion is an equity issue. Women in rural areas, women with less education, and those in the lowest wealth quintile are the most likely to have an abortion without appropriate surgical procedures or medications outside of suitable health facilities. In a PMA 2020 survey, less than half of respondents confirmed using a medically acceptable procedure to complete their abortions. More than half of respondents used other types of pills, medications, or dangerous and ineffective methods like forks, potash, and ink. Women can face dangerous consequences as a result.
It was very, very painful. I don't see blood, just water, and it stinks. When I was unconscious for about 6 hours, I couldn't walk, I couldn't eat, I couldn't do anything. They said my womb has been destroyed.
Social stigma is another significant barrier to safe abortion that makes it hard for women and girls to know where to go for the procedure and for service providers to offer safe services. Stigma complicates efforts to dispel myths, collect data, and improve quality of care.
We still stigmatize. When somebody comes in, you don't even listen to her story. You don't even know where she's coming from. All you want to say is, oh, she's here to procure an abortion. And you look down on her. And so sometimes if I know that, oh, I'm not going to be accepted, why would I go there?
Despite the highly restrictive laws and economic and social barriers, women still seek abortions in Lagos. Survey estimates show that in Lagos, 4 to 6% of women of reproductive age may have had abortions in the past year. Over 60% of these abortions were carried out unsafely, likely adding to maternal death and disability.
We saw complications like perforated uterus, we saw bowel involvement, we saw sepsis, we saw hemorrhage, acute renal failure, and a lot of them had to have either repair of perforated uterus or in fact removal of the entire uterus, not to talk of high-level treatment with very, very strong antibiotics, but we had quite a number of mortality from these cases. It was that bad.
When performed safely, abortion is an uncomplicated procedure. What can be done to end unsafe abortions and reduce maternal deaths in Lagos? First, public and private health facilities throughout Lagos State should implement the State Ministry of Health directive to ensure that high-quality abortion services are available within the full extent of the law. That means performed by a medical doctor to protect the life and physical health of the woman. In support of this important measure, it will be critical that the Lagos Ministry of Health adapt the nationally approved clinical guidelines on safe abortion for legal indications to include provisions to cover the physical health of the woman. Hospitals and health centers across Lagos State, particularly public facilities, should also receive the necessary material and training support to provide high-quality abortion services. Second, the Health and Women's Affairs Committees of the Lagos Assembly should move quickly to press for adoption of the VAP Act, supporting women to terminate a pregnancy caused by rape or incest. The VAP Act has now been adopted in 5 states and the Federal Capital Territory. And in the longer term, Lagos should push forward for new legal and health system reforms. First, Lagos should honor Nigeria's commitment to the Maputo Protocol, which ensures access to safe abortion when a woman's life, physical health, or mental health are in danger. Second, Lagos should expand training for medical doctors so they can operate within the full extent of the law. And finally, Lagos should continue to strengthen the healthcare system by ensuring universal health coverage that includes family planning and safe abortion. Bans and restrictions do not prevent abortions from taking place, but they do make abortion less affordable, less available, and less safe, and put women's lives and well-being at risk. Let's take these steps to make girls, women, and families in Lagos safer and healthier. Lagos can set an example for the rest of the country by improving access to safe abortion and averting preventable deaths.